Hello everyone, welcome to sqadia.com, and in our second section of the lecture topic abortion, we will talk about different laws for abortion. And in this we will talk mainly about the laws of abortion in UK and what are the legal grounds for abortion when abortion can be done, and what are some pre-abortion investigation on the patient. UK abortion law is it was discussed in Abortion Act 1967, which recommend the service should be so as to minimize delay. So, according to this act or law, there should not be enough delay, and if there is a delay, any delay can lead to complications. So there should be enough services available to everyone that can lead to minimizing delays and minimizing complications. Then it should be at early gestation time. The lower the gestational period when abortion is done, the lower are the risk and complications of the abortion. As the gestational age increases, the complications from abortion are very serious. Low risk of complications, again, when it's done in the early period of pregnancy or early gestational period. Counseling is important because that tells the female if they are really ready to do this abortion or not, because if their mind is not fully ready for abortion, then after the abortion maybe they have some psychological problems also. So counseling is important in females who are thinking about abortion. And again, it's their own body and they are the one who needs to decide what they want or what they don't want. And my mommy choose to have me. So again, it's completely the women's decision whether they want to keep the pregnancy or they don't want to keep it. Then some UK legal grounds for abortion. This is divided into about 7 to 8 sections from A to G, and in ground A, this says that the continuance of pregnancy would involve risk to the life of the pregnant women greater than if the pregnancy were terminated, and this decision is totally made by the physicians or doctors, because if they think that if the pregnancy is continued, the danger to the life of the female is, or the pregnant woman is more than if it is terminated. Then in B, there is termination is necessary to prevent grave permanent injury to the physical or mental health of the pregnant woman. Again, more or less the same. If the termination of the pregnancy is done, this can be beneficial both physically or mentally to the health of the pregnant women. In C, pregnancy has not exceeded 24 weeks and continuance of the pregnancy would involve risk greater than if the pregnancy were terminated of injury to the physical or mental health of the pregnant woman. So in this, the only difference is the time period. If the pregnancy exceeded 24th week, usually the risks are greater than keeping the pregnancy. So it is 24th week period is mentioned here. Again, it's the same. If this is period is less than 24th week and the risk of keeping the pregnancy is more than terminating, then it should be terminated. Then in section D, pregnancy has not exceeded 24th week and continuance of pregnancy would involve risk greater than if the pregnancy were terminated of injury to the physical or mental health of any existing child of the family of the pregnant woman. In this section, again, if the risks are instead of pregnant woman, it's more to the child in the family. If it has more bad effects on the physical or mental health of the existing child, then termination of pregnancy is better. In section E, there is a substantial risk that if the child were born, it would suffer from such physical or mental abnormalities as to be seriously handicapped. If during the diagnosis or during the different tests in the pregnancy, it is found out that the child or the unborn child will have some serious complications that leads to permanent disability, then it is usually decided to terminate the pregnancy. F is to save the life of the pregnant women. Usually the termination of pregnancy is done. And G, and the last one, is to prevent grave permanent injury to the physical or mental health of the pregnant woman. So these are the different grounds under which the abortion or is considered and pregnancy is terminated. Then some pre-abortion investigations. In this, some of them are recommended to do, like ultrasound is always recommended to perform for if other, and then other clinical assessment if ultrasound is not available. Then in case of RH incompatibility, anti-D or ROGAM is recommended. That's very important to give this ROGAM to the pregnant women after within 72 hours after delivery and within the pregnancy, to avoid the complications of erythroblastosis fetalis. And some tests are considered if they are requested by the patient. Usually they are done, or if the doctor thinks that these tests should be done depending on the history and circumstances. One is a test against sexually transmitted infections, which are usually chlamydia, gonorrhea, HIV, and syphilis. And then full blood count is usually done also specially to detect if the patient is anemic or not. So that was all about the laws of abortion and what are the legal grounds for abortion and when it is required that pregnancy should be terminated, and then what are some abortion investigations to be done before the abortion. Thank you for watching sqadia.com.